In preparation for surgery, most likely you have been given 4 prescriptions by my office and me. Those prescriptions include 2 that you have to take pretty much what we call around the clock, meaning that you take it based on what it's been advised every so many hours. And then 2 other ones you only take if you need it. The 2 that you want to take around the clock are, number 1, the antibiotic that you've been prescribed. Most likely you've been prescribed either Bactrim or Clindamycin. Bactrim you would take every 12 hours and you take it for about a week. So for 7 days, every 12 hours you take this medication. Clindamycin you would take every 8 hours. And you would again take it for a week for 3 times a day, so every 8 hours. If you have any difficulty with these medications, you call my office and you let us know. Sometimes some people have nausea, some people may not be tolerant of these medications. You call us and we try to basically give you an alternative. The other medication that I like you to take as advised is Lovenox, and it's an injection. It's an injection that we like you to start receiving pretty much about 12 hours after the surgery. For most people, it means that it would be the night of the surgery before they go to bed. So if you have surgery that even ends at 3 o'clock or 4 o'clock, I still would like you to get that injection that night before you go to bed. You don't need to necessarily worry about waking up in the middle of the night 12 hours later. Anywhere between 6 to 18 hours after the surgery is a good time. You're going to do that injection once a night for 5 nights. And the injection criteria, we can show you. There's also other resources that shows you how to do the injection, but most likely you have a nurse or assistant that can help you give that injection. That injection should be performed in some part of your body in which we have not done surgery. So if you're getting, for example, liposuction 360, which involves liposuction of the abdomen and the back, you do not want to inject yourself in your abdomen and your back. You probably should inject yourself in your thighs, your arms. If you've had liposuction of your arms, your thighs, you want to go to another area. And please do change sites. Do not inject in the same site every night. Every night you want to switch to one side versus the other to prevent bruising. That's for 5 nights. Antibiotics and the Lovenox are the ones that you have to take around the clock. The 2 other medication you take only if you need it. One is for pain. Most common one is Percocet or Tramadol. You take that when you feel pain coming. Best is to take it before the pain is very severe. Also try to avoid causing severe pain. So there are activities or things that you will find very quickly that will give you pain. Avoid those things if you can, and expect that this pain medication is not going to work instantaneously, that it's going to take about 20 minutes after you've taken it to work. If you're somebody who doesn't take pain medication and you're hesitant about taking them, you can cut them in half, take half, wait 20 minutes, see if you need the other half. And ultimately, after 3 days, I'd like you to stop taking them altogether and just start taking Tylenol over-the-counter extra strength. There will be some pain and discomfort even when you take Tylenol, but the idea is that these pain medications, the strong ones that I give you like Percocet or Tramadol, do also slow down your recovery, so I want them to be stopped if we can by 3 days after the surgery. And the final medication is Zofran, which is meant for nausea. This medication may be necessary in the first 1 to 2 days after the surgery as you're still recovering from anesthesia. Some people tend to have some reaction to anesthesia and remain nauseated. Some people may vomit. This is pretty rare, but if that happens, you can use Zofran to improve that symptom. With that, if you have any questions, please call us, and we're always here for you. After the surgery, we like you to prepare before the surgery, get your medications, also get all your questions answered before the surgery, so after the surgery, you know about everything that is going on.